Hello, my name is Dr. BenFauzi El-Attrache, and I'm a general surgeon with Excel Health Surgical Specialists. A little bit about me: I actually grew up in the Mount Pleasant, Pennsylvania area. I come from a family of physicians. My dad was a family practitioner. My uncle Salim was a orthopedic surgeon in the area, and now my brother and sister give primary care services in Mount Pleasant, as well as wound care services in the area as well. What I'm here to talk to you about today is gallbladder issues. So many people don't necessarily know what the gallbladder is. I have a little picture here that we can refer to, but the gallbladder basically is something that is underneath the liver. And what the gallbladder does is it stores something called bile, which is a type of fluid that the liver itself makes to help us digest fats. So when the gallbladder fills with the bile, basically when you eat, the gallbladder gets an idea that it needs to contract, and it helps us digest foods. So that's basically the function of the gallbladder itself. Now, sometimes we have issues with the gallbladder, and that's in the form of gallstones. What gallstones are, most of the time, they're stones from cholesterol. And we don't know really why people get gallstones. There's some risk factors that can cause people to have gallstones, such as being older than 40, being overweight, during pregnancy, and actual weight loss itself. And even some people have a family history of gallstones, which can attribute to people getting gallstones themselves. Now, people can have gallstones and not have any symptoms, but some people actually do have symptoms. So what are those symptoms? Those symptoms include pain kind of in your stomach here on the right side, some nausea, some vomiting. Sometimes the pain goes to your shoulder or goes to your back, and that seems to cause a lot of discomfort. And most of the time, the pain gets exacerbated by eating fried or fatty foods, because that's the function of the gallbladder. When you eat fried or fatty foods, it gets a signal and says, I have to squeeze. It squeezes, and if you have gallstones, sometimes that can cause pain. So what do we do about the pain? And what do we do about issues with the gallbladder? Well, sometimes you just have pain from the gallstones, or other times you get an infection of the gallbladder. The best treatment for this is to remove the gallbladder. There are some other modalities that are not the best for this. Sometimes you can give medications or trying to break up the stones, but those haven't been shown to have any good long-term success. So the best treatment is to remove the gallbladder. Well, you ask how we do that. There's different ways to do that. The standard of care nowadays is to do it through small incisions, and we call that laparoscopy. Now, with even more technology, we do the same thing through small incisions, and we could do that robotically. The picture that you could see here shows the 4 incisions that we need to make to do it robotically. And those incisions are usually closed with absorbable suture and glue afterwards, so hopefully you have a nice cosmetic feel after everything heals. Basically what we do is when we go in there, we identify the gallbladder itself after we inflate your belly with air, and we identify the artery that supplies the gallbladder and this little duct that connects to the gallbladder. We kind of clip those and remove the gallbladder off the liver bed, and then take your gallbladder out. That's usually how it's done. It's usually an outpatient surgical procedure. It takes anywhere from an hour to hour and a half, depending on how inflamed the gallbladder can be. And people tend to go home the same day. Now, it's a little different when you go to the hospital and we do it in the hospital, because you may end up having an infection that needs antibiotics for a few days. But it depends on kind of where you see us, whether it's in the hospital or in the clinic. Now, I like to do this robotically, and the reason why I like to do it robotically is the advantages of robotic surgery. Robotic surgery gives you 3D visualization. It gives some ergonomics, which means Basically, my wrists kind of move like this, and I could do the same thing with a robotic instrument. Now, in the next picture, after you saw everything that's set up for the robot, you see something that's lit up green. We actually call that Firefly. And what that is we inject some sort of contrast material that is something we can't see with the human eye, but the robot has the capability of viewing that, and allows us to see the structures there pretty easily. You could see the two pictures that are in comparison there. One of them shows that there's no green fluorescence, the other one shows that there is. Well, when we see that green fluorescence, it helps us identify the structure safely so that we can remove the gallbladder in a safe manner. Now, what should you expect after gallbladder removal surgery? Well, the hope is that your pain goes away, and eventually with time you'll be able to eat kind of the fried and fatty foods, even though we tend to try to have you avoid doing that. But within about a week or two, usually you can eat regular foods, and usually in about 6 weeks you feel relatively back to normal. But keep in mind, even though we did things through small incisions, it takes a little bit while to heal. So we need to allow your body at least 6 weeks before doing anything major such as heavy lifting or strenuous exercise, so that you have a complete healing process and that you don't have any problems from the surgery itself. Now, what are the risks of having these procedures? The risks in general are low, but there's stuff that you should be aware of. Some pain at the incision sites is common. Is there always a risk for infection? Yes, but we give you antibiotics beforehand and we do everything in a sterile manner. The main thing would be damage to the other structures that are in the area. Now, the other structures, as you could tell from the different pictures that we had showed you, the other structures would be kind of the stomach or sometimes the ducts that connect to the gallbladder. Now, luckily, with the use of the robot and use of Firefly, we can see those structures a little better to help us prevent causing injury. But even with laparoscopy, for how advanced the camera is, we can see those structures pretty clearly, and the risk of causing any injury to those structures is less than 1%. These are safe operations that we do, and it's the best treatment for any gallbladder issues. As far as what you do after the surgery, you come back and see us in the clinic. We make sure that you're doing okay, and if you need to see us again, we'll be happy to see you again. Otherwise, we send you on your merry way. I thank you for listening to this presentation today. I hope you learned something about gallbladder issues and signs and symptoms of gallbladder problems. Be happy to see you anytime if you have any problems, and everyone have a good day. Thank you.